Well, I think as a precursor, so it's no different if you revert it back to the weight room, which your listeners have probably got a lot more experience with, is in order to squat heavy and to squat really, if you want to put up a 600-pound squat, you got to squat 200 pounds first and then 300. So you got to get the basics down pat. So understanding an athlete's straight line running. So for instance, I had an NFL player, and actually have the data on a PowerPoint if you'd like to have a look, but we had an athlete with a quad strain. And when the NFL, my team, brought the information, they said, hey, we've got this guy, he's got a big quad strain. Can you have a look at his data and see what you think? And so I had a look, and yes, you could see some signal that would indicate a quad strain, which means they lose their vertical force. But a bigger signal was his right leg. And I said, have you guys looked at his right leg? Is there a history there that's we don't know about, or that you guys haven't addressed? Anyway, they go and look up his records. Sure enough, 2 years previous, when he was in college, he'd had a massive right ankle surgery. And I said, well, I think you've got to have a look at the fact that this guy cannot project. So he cannot, when we look at running, you've got that pull to the ground. So you have a vertical force and you have an anterior posterior force. The anterior posterior force, nowhere near as strong as the vertical, but it's still a big component of how we run. JB Moran showed that. This kid couldn't produce it off his right leg. So his left leg is almost like a skateboard or a scooter. He's having to pull on one leg. And so if we start talking to that guy, that athlete was, I believe, an outside offensive lineman, so running the curves. So he can't run a curve if he can't run straight. You want to get him running straight well and controlled first, then teach him, get him on the curves. So he's got a limitation in straight line running. So I think the concept that SpeedSig tries to work with is fundamental running. How do they run in the first place? If we get that squared away, then layering on all the skills your previous guest talked about curvilinear running, about how we drop a shoulder, about all the types of things. I had a magnificent conversation with the great Dan Pfaff. I was privileged to have a couple of hours with him last week. And what did we look at? We looked at amputee athletes, because you can learn so much from an amputee because they generate force differently. And then you add these unbelievable prosthetics that then have a different category of force on the ground. They're so rapid on the ground, but they still create a torsion in the torso. I'm actually doing some work at the moment with an amputee triathlete, so a young lass who's lost an arm pretty much from the shoulder.